the patient can either be seated, and he has a game-like controller in his hand, so he can control as he either walks or drives through the environment, and the direction that he goes in and so forth. He can, with this headset, he can also see things to his left or right, or even turn around and see what's behind him. Right now he's seated, but he could be standing, and we actually have an alternate controller that's on top of a M16 replica rifle. So it's authentic size and weight, and the controller is right on top of the gun. So if somebody wants to, feel that while they're on patrol, they have that rifle in their hand, as some have wanted to, that's an option. He's on a vibration platform, which conveys the feel of the rumble of the Humvee when he's driving the Humvee through the environment, as well as the explosions are transmitted through that. Over here there's a smell machine, and you can see the little bottles full of pellets, and we just put a pellet in, put a fan to heat it up and kind of blow the smell over him. And again, some positive and negative smells that can be introduced at appropriate times. Here you see the therapist is really using a total of 3 computer screens in this setup. So there are, on the far right, he's seeing a large screen representation of what the patient is seeing through their headset. So as the patient moves, that view changes as well. So it's just exactly what the patient sees. On the middle screen, there's a smaller picture of what the patient's seeing. And then all around it, you can't really pick it up here, but there are a whole bunch of different tabs that the therapist can click on, which can introduce different things, call to prayer, dogs barking, people talking in either English or Arabic. Vehicles can come in, an ambulance or a Humvee, a tank, air vehicles as to helicopters. A-10 Warthogs can fly over. They can circle and land. The helicopters can. You can change the weather, time of day, all kinds of different features. Machine gun fire, IEDs, RPGs, and they can be to the left, to the right. You can change the level of graphics from either minimal to a pretty high level, where the passenger in the Humvee may be shot and you can see them bleeding and so forth from gun wounds. So again, all of this can be individualized depending on what that patient's experience is and kind of what do you think they're ready for at that point in time. You can see they have high quality headphones on for the sound. And on the furthest screen over, which works with this tower here that's underneath the table, there we're monitoring physiology, so blood pressure, heart rate, how much they're sweating, breathing rate, and eye blink throughout. So a lot of different things that we can introduce in the virtual environment. Now this is what the functional MRI is showing us. So in this case, orange is our patients before treatment, and the light blue is after treatment. And so I'll walk you through this here. So the baseline is right in the middle here. And if we look at the anterior cingulate gyrus, that's part of the frontal lobes. That's where emotions are mediated, and you can see that there's a very sharp decrease in oxygenation in that area compared to other parts of the brains. That's a decreased activation that occurs in response to the stimuli that we've presented. And so this we think is associated with the avoidance and numbing features of PTSD. And all these subjects here have PTSD. So you can see again a very sharp decrease there that returns much closer to normal. It doesn't totally go away, but significantly improves. You can see these bars representing confidence intervals there, and so that's a very significant improvement in the level of inhibition that we see there. In the amygdala, which we know is associated with more the hypervigilance, more easily startled features of PTSD, You can see there's significant activation that occurs before treatment there, and it actually reverses to some extent, resolves with treatment. So very significant change there as well. The subcallosal gyrus is basically around where the hippocampus is, which is very important for memories. And you can see there's tremendous activation with the presentation of these stimuli before treatment, and again it reverses, really significantly improves after treatment. So those are all pretty remarkable changes, evidence of the impact of the treatment on the patient. And I'll show you one more here. And so the stimuli that we use in the scanner, we actually present some very positive things, like a baby seal playing in the snow, some negative things of a motor vehicle accident with the victim, a pit bull opening its jaws, a snake baring its fangs. So those are all pictures that have been shown to have very strong emotional charge, emotional responses to them. And then we have some neutral images, pictures that don't really elicit a strong emotional reaction. And so here what we've done is to tease out those things, and I'll just have you focus on the amygdala here. So if you look at before treatment, the negative stimuli elicit a very strong reaction here, whereas neutral stimuli, the confidence interval overlaps 0, so no significant response to the neutral stimuli. So it's really the negative ones where we get the strong response, and in fact that's where you're seeing the big change with treatment. So they're no longer reacting that strongly to the negative stimuli now, whereas their response to neutral stimuli has not really significantly changed. On the other hand, if you look at part of the frontal lobe here, again you see that inhibition. It occurs a little more, not pretty similar amount whether it's negative or neutral stimuli, but the change that occurred is really in response to the negative stimuli once again, not so much the neutral.